Mummy needs a makeover. Have you ever heard of that saying? Well, we're going to follow Melinda as she goes under her transformation with 2 procedures. Today on The Younger You.
I'm on top of the world, now I'm living. And the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep on going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show, we're talking all about mums and a set of procedures commonly known as the mummy makeover. Let me introduce you to Dr. Rose, the cosmetic surgeon that has given Melinda, our patient, back her pre-baby body. Dr. Rose, welcome to the show.
It's good to be here.
Okay, a mummy makeover is a lot of work, correct?
It is.
Okay, so we needed to make this into 2 episodes because our patient Melinda had a lot of work done. What I would consider a lot of work. What is a mummy makeover and what do you do commonly in a mummy makeover?
So typically a mummy makeover involves doing both breast and body contouring. There are a few other ancillary procedures that can be done, but in general, it's breast and body.
Okay, talk to me about body contouring. What do you mean by that?
So it either involves removing extra fat through liposuction or removing extra skin, tightening muscles.
So this is from women who have had a child, or several, decided not to have any more, but want to get to their pre-body look before having a baby.
Exactly.
So when you say liposuction, we all know the majority of women gain weight when having a baby, yeah?
Right.
And it's difficult to lose it again if you have 3 or 4 children. What are the procedures within the tummy tuck that you would be doing?
So typically you remove all of the skin from just above the belly button to the suprapubic area and then tapering along the side.
So you did liposuction?
We did.
Breast implants to make larger, or?
Well, the breast implant functions a couple things.
Okay.
It basically replaces some of the tissue that's removed with the breast lift if they want to go bigger. It also provides a scaffolding to redrape the breast tissues around to create a better shape. So if you just do a breast lift, typically patients are not very happy because the shape isn't what they're desiring. The implant adds a nice shape to the upper half of the breast. The lift lifts the breast tissue up onto the implant to create a better look.
Interesting. Dr. Rose, I have a viewer's question here. Dr. Rose, I have not yet had children. Is there anything that I can do while pregnant to avoid needing a tummy tuck? You sort of answered that a little bit. You've basically said there isn't a great deal you could do.
You know, some women, it really comes down to genetics first.
Darn that genetics.
Yeah. And then after that, it has to do with how well you take care of yourself while you're pregnant, minimizing significant weight fluctuations. I mean, some OBGYNs nowadays really discourage women from gaining too much weight with pregnancy. But
some people do.
Sometimes you just can't help it, you know.
Yeah.
And, you know, the weights are going to fluctuate. Skin elasticity is variable depending on your genetics, and so some women get huge stretch marks and some women have none, even after 4 or 5 kids.
They're the blessed ones.
So,
lucky them. Another viewer question. What is the best and most common implant that you use?
things have fluctuated over the years because we were only able to use saline for a while. Thank goodness that's no longer true, and we have higher quality silicone. So for sure you want to use a silicone gel nowadays because they're better. You have smooth and textured, and I've transitioned more towards textured because textured implants prevent implant malposition later on in life. Because almost everybody, when you lie down after a year, your smooth implants will kind of drift a little bit towards your armpits. We've just accepted that that's normal, but the truth is, women don't love it. And so if a textured implant can prevent that, at least to some degree, that's huge. Also, the second most significant thing is the texturing limits the strong contractile forces of scar tissue around the implant. Something very interesting. Do you think the stigma for breast implants is less in America than it was, say, 10 years ago? Absolutely, yeah. They're very, very well accepted now. You know, the old silicone implants, they should have been removed from the market because they were inferior. Yeah. Saline implants are definitely inferior, but now we've come a long way. Dr. Rose, great information as per usual, but I want to show you some great exercise tips that can help you tighten up those chest muscles at home.
Standard chest press. You will start with dumbbell weights up in the air and take them down to about 90 degrees, and then back up. It's crucial to work your chest muscles, especially if you're thinking about getting implants or any cosmetic surgery. Incline chest press is a version of the chest press. This way works a lot of deep muscle fibers due to the angle. You will lift those weights until your arms are straight and then lowering them past 90 degrees to really break down the muscle fibers. To make it harder, do the same motion but slow it down. Make sure to keep your low back touching the mat and your core activated. With this, you will want to start with your recommended weight and about 3 sets of 20 reps. The dumbbell pec fly will target the pectoral area and the shoulder blades. Have your back touching the bench and your elbows will have a slight bend in them. To make it easier, you can have a bend in your elbows or, of course, grab lighter weights. To start off, you'll want to do about 15 reps of 3 sets.
After the break, we'll be back in the studio with Dr. Rose to find out more about the Mummy Makeover. Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyoungeryou.tv and check it out. Love to hear your comments. Welcome back to the show. Well, here's an interesting fact for you. There were over 300,000 breast implants done in America in 2013, which is almost triple from the 101,000 done in 1997. Dr. Rose, my question to you is, are women doing it more now because the pressures that the society puts on women?
You know, it's definitely multifactorial for sure. I think that's part of it, but in all fairness, I think women themselves just like to look good, and also the implant safety has gone through the roof. I mean, they're so much better now. Doctors' techniques are better, so there's less risk associated with it. It takes an hour to do a breast augmentation and it changes your life.
1 hour?
Yeah, 1 hour.
You think I'd know that, how many I've done on this show. But it just seems so much longer for the procedure when we're filming as well. But when women come and see you and they say, I want to do a breast implant for this particular reason, is there ever a time that you go, you don't need it?
Absolutely. I mean, if a woman is young and she already has a nice shape to the breast and enough volume, then an implant can actually be partially destructive to a breast when you're too young.
Okay.
So you can get stretch marks actually from too big of an implant. It can partially thin out the breast tissue over time so that you don't maintain that nice youthful breast as long. And so really an implant and surgery is intended to restore youth.
I want to get back to the tummy tuck and the breast augmentation that we're doing on our patient. Why did you do the breast implant first before the tummy tuck?
Because of sterility reasons. You know, if you have an implant that's going to be in there, you don't want to risk potential contamination.
Would you always recommend a breast implant or lift when doing this procedure, the Mummy Makeover as such?
Well, almost
always.
Does
it go hand in hand?
No, not necessarily. I mean, I just take whatever the patient is complaining of. I mean, if they're not saying anything about their breasts, I'm not going to say, hey, you should do your breasts.
Okay.
But you know, most women will need something done after having children and breastfeeding for sure.
Okay.
And there's an amazing transformation when you look at before and after pictures in a woman that actually does the breast and the tummy at the same time. It has a tendency to elongate the torso because the breasts are lifted up. So the torso gets thinner, the breasts get fuller, and the torso gets elongated. It's quite dramatic.
Dr. Rose, here's another question from a viewer. Will implants affect, and I get this question a lot, will implants affect breastfeeding in the future?
No, because the implant is going underneath the muscle. It's not even in the breast gland itself. So what it's doing is it's essentially pushing the breast and the muscle out at the same time. If you do a breast lift, the lifting can rearrange some of the breast parenchyma, and we're actually removing some breast tissue, so there's a slight chance that you would not be able to breastfeed after that, or it just may not be quite as effective.
Dr. Rose, if you were to have a tummy tuck, so the tummy tuck is involving liposuction as well, is that correct?
Most of the time, yes.
Does the fat come back?
No, because we are born with a certain number of fat cells. So fat cells throughout your life just fluctuate in their size. So as someone loses weight, they still have the same number of fat cells, but if you do liposuction, you suck out the fat and throw it away, they'll have less total number of fat cells. But the fat that they still have can increase in size, So the fat's not coming back, but the fat cells can get bigger.
Okay, is it true that the maximum you can take out of someone is about 5 litres when doing liposuction?
That's not really true, but that's smart. And that originates from California because there were some people that were being overly aggressive and there were some deaths associated with liposuction. 11 liters lipo and major problems. So it's just a good
guideline.
Yeah, a good guide.
Yeah, but most cosmetic surgeons stick to that. They don't really like to go much higher, is my understanding. What is the age that you would allow someone to have a mummy makeover? Let's just say someone comes in their 25 and they've already had 3 kids.
Absolutely.
You think that's totally fine?
Totally.
As long as they don't really want to have any more children?
Correct. I mean, that's the key. Some women will start young when they're having kids in late teens, you know. So they come in their mid-20s and they're ready to go.
Well, I took some of my questions to men on the street, so let's take a look at what they say.
I think to each their own, you know. People want to do it, it's up to them.
Honest opinion, cosmetic surgery, if people do it, that's their own personal choice. I just feel that it's not really needed. The way you are defines you, so why change that?
I think if you feel like it's necessary for yourself so that you're comfortable with yourself, then I'd say that it would be an okay thing to do.
What's natural is always better. So unless you've been in like an accident, you know, I think that you should go natural.
When we come back, we'll get to meet Melinda and find out why she felt she needed what we call the mummy makeover. Closed captioning for the younger you is brought to you by Mindful Medical. Like us on Facebook for updates on the show and how to join the younger you conversation. The following footage contains surgical procedures. It may be too graphic for some viewers. Let's chat with Melinda and find out what her reason was for wanting a mummy makeover.
My name is Melinda Cavley. I am 34 years old. I am married for almost 14 years now, and we have 2 kids, a 10-year-old girl and a 4-year-old boy.
All right, so excited for today?
I am.
Yeah, it's going to be a major change. You're going to love it.
I'm excited.
Yeah. So we're doing the breast lift augmentation, and we're doing what's called an extended tummy tuck, which I want to explain in a minute with the markings that I made. Okay. And we'll just kind of go from there.
A mommy makeover to me is just a good tune-up. In the mommy makeover, to my knowledge, it's a little bit of lipo, a tummy tuck, and then a breast augmentation.
Well, we have some asymmetry in the breasts, where the right one is a little bigger, so we'll be lifting more on this side and do a full lift on the right, and we'll just do a vertical lift on the left, and that'll make her more symmetric. All right, any questions?
Nope, I think we're good.
Okay, sounds good. So a mommy makeover basically consists of either doing breast and body contouring or other little procedures. Now, we typically will do breast and body together because it makes such a dramatic change for the patient. Breast being lifted and enlarged and the torso becoming somewhat elongated in its appearance because the breasts are uplifted more.
I've actually lost a lot of weight in the last little bit, and so I kind of feel like it's my reward at the end to really get my body back the way I want it to look.
So this patient today has breasts that look completely different. So her right breast is bigger, it's more droopy. So if she came to me and she had 2 breasts that look exactly like her left side, I would just be doing a vertical breast lift augmentation. I will also probably have to use maybe a bigger implant on the left than the right. It depends, because I will be removing more extra, breast tissue and skin on the right side. And so if that makes her breast the same size as the left one after the lift is done, then I won't have to use 2 different size implants.
I don't have high expectations for myself. I think, like I said, it's just fine tuning. I kind of laughed with my husband a little bit of, you run a marathon to have that accomplishment, and at the end you get the medal. And it's kind of the prize at the end. And that's what I kind of feel like with the weight loss and the changes I've made in my life. I did the work, and now it's kind of just my prize at the end.
You have a wonderful family and beautiful kids, but it has a tendency to destroy the body to some degree. And this is something that a lot of husbands just don't quite get. They say, why don't you just go to the gym, you know, and they kind of can get on their wives a little bit. But if they realize that there really is unfortunately nothing that the woman can do to tighten her skin, there's nothing that a woman can do to get her muscles to come back together along the midline, and nothing short of surgery is really going to fix that. There's nothing you can do to lift your own breasts, you know, I mean, you need a plastic surgeon.
I think with the age though, there is that stigma that comes. I think there's a lot, and there probably will be people that will judge me, and there is a lot going into thinking about it, you know, but I get to live my life and I need to be comfortable with myself. And especially losing the weight, looking in the mirror when I'm still not comfortable and still can't feel confident, there's a problem. And it's okay that I can get tweaked.
So cleavage is a function of how much tissue patients have along the central portion of the breast. But then also if you release the muscle enough, you can get an implant pretty close to the midline, but you don't ever want to get it to the midline, because then you can get a uni boob, as they call it, or a symastia. And so what I've done is I've released it to the level that I would like it to be, and we're going to put a sizer in now, and then do the lift around the sizer, and then kind of go from there.
You know, when I think about being sexy in front of my husband, as I think back, definitely having kids, but the weight loss was the biggest thing that changed, and I definitely did not feel confident in front of him then. So there is a confidence now, but I want to feel good. I don't want to just feel confident, I want to feel good. And maybe that's selfish of me. Some people might think to feel that way, but I feel like I deserve it, to be able to look in the mirror and like what I see back.
Whenever you're working with an implant, the worry is potential contamination of the implant. So we always want to put the implants in when everything is as perfectly sterile as we can possibly imagine it to be. We want to do that part when everything is absolutely pristine, as clean as it can be. Once those incisions are closed, then we can move down to the abdomen.
I am totally doing this for me. My husband is very supportive and has been a sweetheart to support me in it, but it's more for me. I mean, the weight loss and the healthy was definitely more for my family, a lot of me too, but was just definitely, I realized at some point I wasn't going to be around for my kids if I didn't do something different. So I would say the health change was more for them, but this is purely for me.
Coming up after the break, we'll watch as Dr. Rose concludes the breast augmentation portion of Melinda's Mummy Makeover. The following footage contains surgical procedures. It may be too graphic for some viewers. It's common to have multiple procedures done at the same time. Let's finish watching part 1 of Melinda's transformation.
My expectations after the surgery, I don't know. I don't know that I have huge expectations of, oh, I'll be this size exactly, or I'll fit into these jeans, or I'll fill the swimsuit out the right way. I think it's more just that confidence again. That's just getting it back to the way it was before I had kids and before the weight loss, and just kind of cleaning the slate a little bit.
The only scar that patients typically will see is the vertical scar that goes from the lower edge of the areola down to the inframammary fold. The fold incision is really well hidden because the breast will kind of fall down a little bit and it'll hide it. And the one around the areola isn't really that obvious because there's a pigment change there anyway. And so over a period of about a year and a half, which is where it takes that long for the scar to lighten and mature as much as it's going to, then that will become less and less apparent over time. And the honest truth is we do not have patients complain about the scars because they just love the shape of their breasts.
I think my fears of the procedure is, I know it's elective. I know that this isn't I'm doing this to save my life or anything like that. So there are the fears. The blood clots are a big concern and stuff like that. So there's that, and the pain and the recovery factor is going to be hard. I'm not one that likes to kind of sit around and sit still, so I think that will be hard to kind of take it easy for a little bit and deal with that. But
you know, if there's anything that I think I do really well, it's breast surgery, and every patient for me is completely different. And there are little subtle tweaks that I have to do with the techniques, you know, in order to make the patient look good. If it's the size of the pocket, the position of the folds, because some fold will be higher than another one, you know, areolar asymmetry. There's so many little things that I take into consideration with each patient, so you don't get bored doing it.
I know that there is judgment that will come. You know, we wanted to have a big family, but that's not the way it worked out, so we're done having 2 kids. We actually found out I had a kidney problem, so we were actually counseled not to even have our son. So we were just supposed to have the one, and we kind of listened for a while, and then we rolled the dice, and it worked out well, and we were blessed with our son. So we kind of joke, instead of quantity, we got quality. So we'll take the 2. We are very blessed to have the 2 that we have.
So the implants that I'm choosing for her are a textured implant, and they're silicone. And the reason why I'm going to do this is because it's been shown that there are 2 major complications with smooth implants. One is that because of the surface being smooth, the implant can actually kind of auto-dissect or move within the tissue over time. So patients and doctors have just become used to accepting that that's common and normal. When the patient lies down, the implant sort of will drift off to the sides. Well, one of the things that happens with a textured implant, it almost has like a Velcro effect on the inside, where the implant won't move as much. I mean, it's still possible, but it's a lot less likely, where the implant wants to just kind of adhere to the tissue and it doesn't displace. So the textured surface in her is important because of her asymmetry, and also her rib cage is slightly different. So if her ribs on the right side being more slanted, with a smooth implant, the implant would kind of fall off the hill, so to speak. Whereas with the textured implant, they'll just stay where I put them. So now we have 2 vertical breast pillars right here, and I'm going to suture those to each other, and it just pushes the breast up like this and creates a nice uplifted, perky appearance.
I have had discussed it with my close friends. Some of the others, I don't know, I go back and forth. Do they need to know or do they not need to know? This procedure doesn't define who I am. I'm still me. So all it is fine-tuning me. So the friends that I have told are very supportive and understand, because they've seen me through the process. And those that will maybe judge, that's unfortunate for them, because I'm confident in the choice and the decision that I'm making.
Melinda has worked hard to lose 70 pounds and gain back the confidence she lost after having children. One of my favourite things about this show is how I get to see someone's transformation step by step. Today was just part 1 of our Mummy Makeover, and the exciting conclusion is still to come. Melinda's journey isn't over just yet. Tune in next week to watch the conclusion to the Mummy Makeover and see Melinda's final results. For more information about the show and Dr. Rose at the Rose Clinic, head over to theyoungeryou.tv, and I'll see you next week. Coming up on next week's episode of The Younger You, we'll get to see the final results of Melinda's Mummy Makeover. The Younger You set provided by Madison McCord Interiors.